Hello, my name is Angela van der Plas, and I am Manager of Real-World Evidence and Epidemiology at Philip Morris International. And I would like to present to you the results of a pilot study in Japan aiming at assessing the collection of data from a sample of subjects visiting a dispensing pharmacy in Japan. Real-world evidence sources are abundant in many countries, but unfortunately, the systematic collection of detailed tobacco product use is overall not guaranteed. Additionally, there are not many recent studies describing the demographic characteristics of subjects being prescribed smoking cessation medication in Japan. This study aimed at evaluating whether the administration of a questionnaire in this population was feasible, as well as collecting their characteristics such as tobacco product use patterns and demographic characteristics. This was an observational, cross-sectional study using a self-reported questionnaire to identify attributes of subjects undergoing smoking cessation treatment in Japan. Subjects were 20 years or older and had been prescribed smoking cessation therapy. The questionnaire contained questions regarding demographic characteristics, characteristics of their cessation attempts, and tobacco use patterns. We used descriptive analysis in this study. Now let's move on to the results. Here you can see the demographic characteristics of the subjects. The majority of subjects were between 30 and 59 years old and were mostly men, about 73.1% of them. Exclusive heated tobacco users were shown to have higher education levels than cigarette smokers, and they were also more likely to be employed in a company than cigarette smokers. 51% of subjects reported at least one disease diagnosis. Cigarette smokers and dual users, those who use cigarettes plus any other tobacco or nicotine-containing product, were more likely to report disease diagnosis than heated tobacco users. Because of the study design, this being a cross-sectional study without follow-up, no causality assessment can be done. Here, we can see the reasons for attempting smoking cessation, with health reasons and saving money being the top two reasons given by participants. When asked about changes in consumption compared to the month prior to deciding to quit, current quit attempt, single product users were less likely to modify their tobacco product use consumption, while over 80% of those using multiple tobacco products had actually decreased their consumption. This observational study aimed to assess the feasibility of collecting real-world evidence data from subjects who were prescribed smoking cessation medications in Japan. Exclusive cigarette smokers differed from exclusive heated tobacco product users in terms of educational level, employment status, and occupation. About half of the overall study population reported having concomitant diseases. This percentage was significantly lower in exclusive heated tobacco product users than in exclusive cigarette smokers and dual cigarette smokers with additional tobacco products. Tobacco product use consumption changes were significant among the exclusive product use categories, with multiple product users being more likely to decrease their product use consumption. Administering questionnaires to subjects filling their prescription for smoking cessation treatments in Japan is a feasible way of collecting real-world evidence data to complement pharmacy data. Thank you very much for listening.